Okay, we are now going to drape out this patient for a CME or median stenoscopy. So remember the prep parameters were, we started at the suprasternal notch, that's where the incision is going to be made, but we draped out the entire anterior chest in the event of a median sternotomy. So we have to make sure that we drape out in accordance to a median sternotomy. So we'll place a drape right at the xiphoid process. And then just to protect, we'll go on this side. We'll go right at about the nipple line, all the way up the anterior neck on that side. And this can be done with either utility drapes or blue towels to square off. The other nipple line, all the way up the anterior neck. And then the final, fourth one, right below the chin. Remember, the incision's going to be made 1 to 2 centimeters above the suprasternal notch. Now, the next drape that will be used is some type of a split drape, okay? So we're going to first orient ourselves to that. Open that all the way up. Usually there'll be someone else helping you drape. The first thing you're going to want to do is anchor this split drape right there below the xiphoid process. Again, this would be placed on the patient's skin. Typically, the next thing we will do is the right or left side of the tails of this split drape. This will follow the lines of your square-offs, whether they be blue towels or utilities. Now I'll come to this side and anchor this one. In the similar fashion, all the way up. The last thing we need is an overall head drape. And we may need some type of a lower drape to finish off the bottom as well. Again, we're anchoring this, we're keeping this right here. We could take some non-perforating towel clips and secure it right here. And so now we have the patient completely draped out for a CME or median sternotomy incision. Now, hopefully we never have to do a median sternotomy incision. So what most surgeons will do is cover up the chest with just a blue towel. Because remember, our incision is going to be 1 to 2 centimeters above the suprasternal notch. We don't want to make a median sternotomy incision. That's worst case scenario. So this is where our incision is going to be, so they might just cover up the chest. And that's it.